The Children's Center Annual Legislative Advocacy Day is very critical to our operation, our functioning, and also to engage our consumers, our clients, our children and our families in learning how to advocate for the public policy that's important to them.
The laws need to take action. These bills need to be passed. Our children need help. Adults too, but our children, that's where we start from the bottom. In the mental health sector, what we have found is that there are 1 in 5 children in America who have a diagnosable mental illness. However, 70% of those youngsters do not receive the care that they need.
Legislative Day advocacy is extremely important for the agency and the state and the community as a whole, because what it does is allow our community and citizens to come down here and have a voice. Many times what we tend to feel is that we don't have a voice. This allows us to take a stand and voice our concerns to our legislators so they hear about the needs of our community.
And the other area for us in terms of messaging to legislators has to do with education, early education support for K through 12. We cannot balance our budgets on the backs of children. We have to realize that in order for the state to be strong, we have got to raise strong children and successful families.
Understand that mental health is on the governor's budget agenda, and we want to encourage you guys to ensure that it stays on the budget agenda and to make sure that we start to really have real conversations and make a budget priority our mental health system. About 1 in 5 children have a diagnosable mental illness in America, and 70% of those children do not receive the care that they need, and it's because, in part, access to care. We don't do a good enough job of making sure that we have a comprehensive system to make it easy for people to get the help that they need. I believe that children should be happy. I believe in seeing children playing. Children should not have cares. And if they have health issues, be it physical health issues or behavioral health issues or emotional issues or having experienced some sort of trauma, we need to wrap our arms around those children and ensure they receive the care that they deserve.
Not only is it important for us to advocate on their behalf, but also for us to engage them in that process. Part of what we're committed to is giving children and families opportunities to empower themselves, and really our mission speaks to that, helping children and families to shape their own futures. So Legislative Advocacy Day both serves their needs in terms of policy, but also affords them an opportunity at a community level to have an impact in their own well-being long-term.
We have to send a very strong message that children should always come first in our conversation. We take care of them before we take care of anything else that may be on our agenda. We have 500,000 citizens in this state who have no insurance coverage right now. And they are suffering, and their families are suffering due to a lack of access to critical health care needs. And so we can't cut any deals on Medicaid expansion. There's no deal to be cut. We need to have it. We need to have it right now. And I'm hoping that as you meet with legislators, you will reinforce that. And part of why you want to do that is, as part of the Medicaid expansion, you begin to get parity for mental health.
All of our services, the way our society works, most of what we do is designed around a presumption that we all have the same neural makeup. And so as we now look at the important work of this commission, it's with an eye toward making sure that we develop a system that works for all of our citizens. And so the support services, there's no question we need more support services back in communities. We need better housing solutions. We need better physical and mental health care for people with mental health conditions.
what I hope is that legislators will really understand the importance of hearing families. They hear employers all the time, they hear lobbyists all the time, but there's nothing like looking in the face of a little child who needs support. Child doesn't even understand what it is they need, but it's our job, and we want to make sure that legislators understand that it's very critical that they listen to these children, listen to the families. Families are suffering in the inner city of Detroit with a myriad of issues, and we need to be able to offer the support to them so they can turn things around and be successful in their families. And that's what we hope the legislators heard today. We hope that they heard that they cannot balance the budget by cutting early education, by cutting mental health services, by not providing all of the support that families need. That's not going to help us as a state to be successful. So we hope the legislators understand that in order for Michigan to be strong, Detroit and Wayne County have to be strong, and that starts with our children.